representative speech. We will be hearing from Bonni Doherty. Who here knows somebody who's been directly affected by either breast cancer or heart disease? How about know anyone who has been denied themselves health care because they're afraid of the financial burdens it may impose? Did you know heart disease is the leading killer in women in America? And 42% of the women who are fair to poor health deny themselves coverage every day. My name is Bonni Doherty, and I'm an executive fitness coach. Today I'm going to talk about how I use my experience in Young Careerist programs to enhance, educate, and influence women in a positive way as it relates to health care. This is a complex problem, which there may be many solutions for. But I'm going to talk about two tonight that I find that are deeply inspiring to me, which is to prevent and protect. It's essential that we help women each and every day and educate them on the power of prevention, as well as find an equitable solution should anything occur. In my early 20s, working in the occupational therapy field, I thought it was going to be my job just to treat patients, but that wasn't necessarily the case. I first had to take insurance papers and separate them into two piles, one I couldn't treat and one I could. Out of curiosity, I would go down the halls and ask, who are these people that I'm not treating? I would go into the bedrooms and I would look at them, between the ages of 45 and 70 years of age, and in great rehabilitation condition for me to see. So out of concern, I would go back to my superiors and I would ask, why can't I see these people? And it was at that moment when I realized things were not as they seemed. Not only was I unable to treat patients that did not have health care insurance, but also people that did not have the right health care insurance. This answer definitely left me very sad and depressed, mostly crying in the ladies' room. No kidding. And also, I knew I couldn't do anything much about it, because literally I knew our paychecks were directly affected by which pile we chose. This story, along with my journeys living around the world, working in the healthcare field, did leave me with two pearls of wisdom. Again, prevent and protect. As for prevention, this is why I focused my life's work on preventive wellness, teaching people things like exercise, yoga, meditation, proper nutrition. These are things that women can do every single day of their life to prevent any kind of problems from happening. Things like 1, doing cardiovascular exercise. 2, eating smaller meals throughout the day. 3, eating less sugar that are in their meals. 4, taking deep breaths. 5, drinking plenty of water. 6, doing yoga and meditation. As for protection, if you don't take the time now to find out about women's issues, you literally forfeit your right to influence them in any way. So it is our job to do this. You can protect yourself by 1, being informed about the women's issues that are happening nowadays. 2, be aware. Be aware of the women in your community that may need your help. 3, be active in your personal preventive wellness. 4, be engaged in getting your own levels tested. 5, be educated in the research as it pertains to your own personal needs. Number 6, last but not least, be involved. You can join great organizations like Healthcare for All Colorado and great senators, House representatives, corporate sponsors, citizens, and physicians who are all pushing for a great act, HB 091273, which would allow health care for all Coloradans. This is something I actually spoke about when I was a senior in high school. This pilot program that would pass in Colorado would actually help a federal program, HR 676. In closing, what can we do to make a difference? Because I know if we work together as a team, I know we can make it happen together. So I want to thank everyone this evening for giving me the opportunity to share how to inspire, educate, and affect women in a positive way as it relates to healthcare. Thank you, and be well.